We're also faced with an ageing population. In order for our health services to cope, we need to make sure we care for these people in a way that is sensitive to their family members and loved ones, and that is also effective use of our resources. Your research may help us to identify ways to better manage the interests of patients in the area of palliative care. And certainly, I am very encouraged by the introductory comments that I heard here today, that there may be indeed a greater degree of focus around the realities in those particular areas, because we do have an ageing population, and indeed in many ways in dealing with the healthcare choices of ageing people, I don't think that we actually take on board enough of their concerns and their desires. And sometimes the treatment which is not only offered to them, but is actually given to them, is not in accordance with their wishes deep down, but is more in accordance with established practice, this extraordinary intervention that we will often have, and sometimes the desires of their families rather than the individual. It also concerns me, and I'm informed recently, that as little as 5% of those people who are residents in our aged care facilities actually have an advanced health directive. And that's something which is very, very important and should be a part of discussions between families and of course with ageing family members as well. And of course this is a very, very complex issue. It's an issue of great sensitivity, and it's something that can be very quickly derailed. But I think the important thing is to have these discussions against the background of choice and appropriate care, and I think that by and large to date, much of that debate in the broader public context has been very much devoid. But your research centre can actually do a lot in actually bringing a whole new intellectual ability to discuss that issue, to actually look at the rights of individuals, to look at what are the competing interests and the checks and balances that can be put in place in any of those discussions that need to be had within the community. And I really encourage you in that direction. Once again, thank you for inviting me to speak at this official launch. I applaud you on the opening of this centre and look forward to the hearing of the excellent work which is not only being carried out now, but will certainly be carried out in the future. And I have no doubt that it will be very transformational in health law in Queensland in the future. Congratulations to you all. Thank you.